what are other things that families should maybe consider when they're pursuing a hearing test for their baby? What are those kinds of things?
That's a really great question. There are evidence-based, research-supported methods to complete testing with babies, and the families should really make certain that they're going to a clinic where the audiologists that are doing the testing are highly experienced and they're following evidence-based protocols. So a good question to ask is, how often do you do this type of testing with babies, the ABR test? It's an important measure to do at such a young age when a child's developing their auditory and speech and language skills, and it's really important that it be done accurately, and that's going to be more likely if it's done in the hands of an experienced audiologist.
Yeah. So a pediatric audiologist who's done a lot of those.
That's exactly
is what
right.
I hear you say.
You're exactly right.
And then asking them, how many of how often do they conduct that test? What's their experience being? And also then what's been their experience in fitting babies?
That's exactly right. Yeah. All good questions to ask.
Are there particular questions when you talk about fitting hearing technology? Any questions that a parent should be asking as that moves forward?
Without a doubt. I mean, there are a number of different features on the hearing aid that should be selected so that they're pediatric or child friendly, like tamper-proof battery doors and that sort of thing. And so it's really critical or vital that the appropriate hearing aid is selected, but then it should be fitted appropriately as well. And now we have technology that allows us to place a tiny little microphone in the ear canal and evaluate or determine the volume level of the hearing aid while it sits in the ear. And that's critical to do. That's vital because we can ensure that the hearing aid is providing audibility for the child and that the volume level is also safe and should be comfortable for the child as well. And if that type of measurement, the probe mic, the real ear probe mic measurement is not done, then it's fairly likely that the hearing aid will not be set appropriately for the child. If it is done, it's all based on research, and we can be really likely we can be very confident that the hearing aid is fitted appropriately for the child.
And as a listening and spoken language specialist, that's important to me as I work collaboratively with a pediatric audiologist because kids talk like they hear.
Exactly right.
So if they have access to all the sounds of speech, their speech will indicate that.
Yeah, that's exactly right. And it's all about providing access to the auditory areas of the brain. And we can do that now with existing technology. We need to know that hearing aids are fitted appropriately to make sure we're optimizing access to the brain. But also, too, if the child doesn't have access that we want, or if they're not making the progress that we want, we need to know that the hearing aids are fitted appropriately so then we can make the next decision and move forward with a cochlear implant.